kōrero in this podcast are of a general nature. For specific advice, please talk to your tākuta or tohunga. It's Kōrero Prescriptions. Because kōrero is healing. He rongo a te kōrero. Nau mai hara mai ki tēnei paki here roki roki. E te iwi nau mai ki tēnei paki here roki roki. This is Kōrero Prescriptions, the podcast about hauora, where kōrero is healing and then you take what you will as your prescription. Nō reira, kia mau tonu mai. Well, e te whānau, the kupu hauora. There's a key word in that, hau. We are talking about respiratory illnesses, and it is our honour to have Dr. Grace Malcolm come and shed some light on this kaupapa, rather broad kaupapa, so I apologise. But it is a kaupapa and an illness that affects Māori more than others. So can you tell us a little bit about your experience with this kaupapa?
So you've got two kind of balloons that sit in your right side and your left side of your chest, and this is really simplified. And if you imagine that there's a little tree that starts from the centre of the chest and it actually grows out into each of the lungs, and at the end of those branches, and those little branches in those trees, you've got kind of like these berries, like clusters of berries that sit on the little branches, that sit on all the branches. And then you've got kind of around those, you've got blood vessels, if you like, that flow around all those berries and that collect up. It actually takes oxygen. It exchanges oxygen and carbon dioxide. And when it's oxygen, the bloodstream takes all that oxygen and it delivers it all around the body. And when it's carbon dioxide, the body brings back all the used oxygen and then puts it back into those little berries, and then those berries come back to the main, through the branches, and then come up and they are breathed out. Okay, that's
Whoa.
a really simplified picture of what the lungs are like. So if you imagine at any time when it comes to illness, at any time when those berries get filled up with fluid, with infection, and that's basically that area of the lung that's completely cut off and cannot supply oxygen to the body. When you've got things like cancer cutting off main branches of that lung, then you've got, you've got no delivery of oxygen to the body. When you've got smoking, and what the smoking does to those berries in the lung is that instead of you having little berries, bunches of berries, what happens is that the berries kind of burst and they just form one big sort of bubble, but that big bubble doesn't have as much oxygen giving capacity as all those little round berries, okay? So why I talk about, sorry about the analogy.
No, I love this analogy. It makes it very clear.
Yeah, because why I talk about it so that you can understand what's happening to your lungs. And so with asthma what happens, and so the little branches, which aren't really hard, they're kind of quite fibrous, hey? So those little branches, they get affected by allergies or allergens, whatever's going on out in the community. It gets, like hay pollen or whatever, and they affect the little branches of the lungs, and what happens is they get all swollen, then they start compressing, and so then you have it, and not only do they press, you can get oxygen in, but often with asthma, they compress and you can't actually get the air out. So people, we breathe in oxygen, And
the
that's
carbon
what-
dioxide
that's
goes
what
out.
feeds our cells, and then once it's used up, it gets turned into carbon dioxide, and it gets transported back to the lungs, and then we breathe it out, and that's
So if you can't get that stuff out, it must make you feel pretty horrible.
Yeah, people die. People can die for any. So that's how important the lungs are. Hey,
Yeah. One of the biggest issues here in Tūwharetoa, that I'm not sure if it just wasn't talked about or if it wasn't recognised, but COPD is quite prominent here. What is that?
Yeah, so COPD, it's a combination of things. It can be emphysema, and COPD is often as a result of smoking, but it doesn't necessarily have to be smoking. It can be things like some kids, when they're born, they were born premature, and so they're, and usually the lungs do develop into as they get a bit older, but sometimes they don't. And while they're young, they're exposed to things like bronchiolitis, which is a viral issue. They get multiple episodes of bronchiolitis, they get pneumonias, they get chest infections. And so it just puts them at a disadvantage kind of for the rest of their life. Sometimes they can go on to develop things like bronchiectasis, where there's a lot of phlegm that's produced by the lungs, and people can cough up things like a cupful of phlegm every day.
Whoa.
So my point is around the COPD, which is chronic obstructive pulmonary disease, and pulmonary is the lungs. So it's a chronic condition. The thing is that previous infection have affected their lungs in such a way that they've gone on to develop a chronic condition as a result of it.
So this is the chronic part.
This is the chronic part, and so that's one way. That's called emphysema, and they're basically bubbles. The lung just all the little berries burst, and then you got big bubbles. The other part is with the bronchitis, and bronchitis is when, again, you've got the bubbles, but they're filled up with fluid, and people just, with bronchitis, they cough, and out comes lots of mucus. It's just white mucus. Sometimes they get infected, and it can be green mucus, and they can get pneumonia and all sorts of other things, but the point is that instead of those berries having air in them, they've got mucus in them. They end up becoming more and more short of breath until, initially they can't walk 100 metres like they used to. They can only walk 50 metres, and then they can only walk 20 metres, and then they have difficulty getting up at night and walking to the toilet, and then they need oxygen just to be able to kind of sit and be still. And that's all the different stages of COPD that people transition through up until the time that they pass because their lungs stop functioning. People experience it as happening, it's only just started in the last year, in the last 2 years. In actual fact, it's been a lifelong process that's actually damaged the pulmonary system, the lung system.
Holy Rick. Okay, so then what are we talking about in terms of preventative? I mean, we're going into the topic of immunisations here, but we have to.
So what the vaccinations do, as all vaccinations do, or immunisations, is they give, whether it's children, adults, or senior people, our koeke, they give the immunisation, and it gives the body a little bit of that, a taste of what it's like to have that condition, okay? And when the immunisation does that, then the body has a chance to build up its defence system. and it can call it all its soldiers and anything, and it builds up a defence against that particular immunisation or vaccination. It builds up a defence against it, so that when the real thing comes along, one, it's forewarned, it's pre-armed, and it actually knows how to fight it off quite quickly. And not only that, when you do get the condition, because the body's been able to mount a response, an early response, and quite comprehensive, the symptoms that you experience aren't as severe.
Right.
So immunisation saves people, hey?
Yeah.
And that's a really good point that you raise, because I get that, especially amongst our Māori people, and especially since COVID came along, Māori have become more and more wary of immunisation. But in actual fact, the reason immunisation came into place was because way back when, if you think about the war and influenza, or pre-war influenza, polio, chickenpox, measles, TB, meningitis, they kill children. They don't kill all children. They don't even kill most of the children that they come across, okay? But they do kill some. And if it's your child, you would wish that there was a vaccination that people had taken in order to prevent your child from getting sick and being affected.
Yeah.
So immunisations work from what we call herd immunity. If 90% of the population, or most of the 100% of the population is vaccinated, that means that it protects those ones who are really vulnerable from getting the condition. And it's those vulnerable ones, which is what happened in COVID. It's our elderly, our very old and our very young, and our ones who are sickly. Those are the ones who get affected, and those are the ones who die. And those were the ones who died during COVID, and those are the ones that die when there's not enough herd immunity in the community. The other, all the other immunisations, the childhood ones, the older ones, those were kind of a way of immunising. They haven't been shown to kill or to maim, or you can get localised reactions, and I know that people say, it caused autism and all, but there's been no evidence or clinical evidence of that. The COVID vaccine is different. COVID is a different kind of vaccine. It was delivered in a different way, it's made in a different way, it acts differently to the other immunisation. So the COVID vaccination was the first one that the ministry said it kills people, right? And it did. It did kill people. It killed people who were vulnerable in terms of heart conditions.
Right.
And those people who some of them who had the vaccination, they did die. They died of things like myocarditis and pericarditis because their hearts, they get really inflamed, and the heart just doesn't pump properly. They died. And there have been, I can't remember how many deaths, but there were some deaths, not hundreds or anything like that, not even maybe 10, but there have been deaths. And I dare say there have been deaths that haven't been recorded, as being associated with the COVID vaccine, but they definitely were. Yeah.
And we've certainly seen some of that within the community, but I think it was, it's the information about that being a risk that wasn't available at the time, right? That makes people a bit sceptic.
Yep, distrustful. Yeah. Distrustful. And there is a lot of distrust. But that's my experience, and it's what I try to explain to people.
I, as part of a doco about the Spanish flu, I had a look into my own whakapapa and found that one of my koroua, his job was to go around and collect the tūpapaku and bury them. And it was asked of him why didn't he get sick if that was his job, and he attributes his oranga to whiskey. So, you know, these old school methods, they swear by the Wihiki. What does whiskey do?
Oh, I don't know what whiskey does except makes you feel better.
I guess so.
And gives you a sense of, resilience and whatnot. So he attributes it to the whiskey, and well and good. What I would say is that, some people are immune. Some people don't pick up things. So it's that inoculation effect, hey, and immunisation. So sometimes people get immunised by the vaccination. Mm-hmm. Sometimes they get immunised by getting the actual condition themselves.
Right.
And so by getting the condition themselves, and then it doesn't kill them, it doesn't even disable them, but they do get it. They get the virus, they've built up an immunity to it, and then after that, they're protected. And the whiskey helps.
Right, there you go, Te whānau. You heard it here first. The whiskey helps you to feel better.
But
not sure if it's a cure.
That's right. But generally that's the reason why some people have immune systems that are resistant to whatever's going on, and some people don't.
Is that immune system, is this hereditary? You know how like certain mate come down through the whakapapa. Does immunity come down the whakapapa?
I dare say in terms of, family fortitude to medical conditions. Some people are really well in their whānau. Generally conditions tend to, if you look at family, conditions tend to run through families. That's not a medical thing. That's my observation.
Yeah. Like before, I have learnt things that I never knew, and I'm so grateful that you come to hei horai te māramatanga mo tēnei kaupapa. Is there any last sort of messages you want to give to everyone listening?
I do want to emphasise do the natural stuff first, and some clinicians, they'll help you to do the natural stuff. Do the natural stuff first. Work with the clinician to do that. And in the end, if that's not going to do it, or if that's not enough, then you've obviously got to go into the other side of things, which is the Western medicine and other practices.
Ka pai, tēnā koe. And koera te tino rangatiratanga, I guess, in you have a choice, you know. That is tino rangatiratanga hi ato hauora, as our Queenie said. That is it right there, koera te tauira. E mihi ana kia koutou, I whakarongo mai ki tēnei hōtaka. Thank you for, to our manuhiri for coming, and just shedding a whole lot of light on things that we don't normally talk about and just have misconceptions about. So thank you. I certainly now am a lot clearer. Nō reira e te whānau, I hope that you can take away a few of the gems that we've laid out for you today. This is Kōrero Prescriptions. Tēnā rā koutou. This podcast was sponsored by Raiha Paki, production to Wharetoa Mohi, post-production Raiha Paki, director to Tūpotama Paki, production manager Sierra Tulloch, producer to Tūpotama Paki, presenter, researcher Raiha Paki, executive producer Leanne Puohotaua, reo en tikanga QA Hinana Media, production house to Wharetoa On, production assist Raylene Walker.
He whakapiki is our opportunity now to put into action the aspirations of our people.
really important because it's helping us to come together as providers for our whānau. So, not even that whānau, for our whānau. Kaimahi.
We're either tū wharetua by whakapapa or we're tū wharetua because we live in this lohe. And so when you peel some of those layers back, actually the challenges become opportunities to come together as whanaunga and opportunities to work better together.
So our whakapanui is to support our kaumātua to access services.
I hope to see come out of it is that we actually be real, we be honest, and we look at each other as whānau, not as providers and all the dissections that we have.